Hi, thank you for being and staying before I start, because that was so interesting. I hope I could compete against that, but I don't think I can. It was a really brilliant presentation. Really, I'm here to try and sort of educate you into complementary therapy against alternate therapy. Really, how many people have ever had a massage from one of my team here at the Royal Free? 1, 2, 3. Well, that's good, but there's a lot more of you here. And the thing is that we can actually de-stress you a little. It's very simple. What we do is very simple, but it's just a calming way that we work. And the whole thing is that when you're here for an appointment for anything else, as long as you let us know, we can see you in our treatment room. So, it's like white coat syndrome, where you're nervous about results. We can actually calm you down before or after. So do use our service in that way, because that's what it's here for. When I started 23 years ago, I did 60 patients. Last year we did 29,029. So you can imagine, not all by me. Nadine's one of my therapists. She's at Barnet and Tottenham, and we're at 6 places now. But yeah, we do fund the service through charity sources, but it is a free service. There is no charge to you whatsoever. We see you for a 20-minute spot. A 20-minute spot, we can do a damn good back on there. I'm going to demonstrate today how to do a back for partners and family members, because what I do here is that when a partner does do a massage, they tend to be too deep, and it's the one thing that you shouldn't have. If you have a professional therapist that comes to you or you go to them, they should change their technique. We would use a clinical style, which is stroking and no pressure points. The pressure points can cause bruising for obvious reasons. Then your body's got to heal a bruise. So it's a very, very gentle procedure, but it's a really calming procedure. And we were Nadine and I were saying about the stressful situations, certain things like that can be handled by visualization, and it's a very simple technique that you can do to actually go through those moments. And what it is you think of your most favorite place, and it can be anywhere in the world. And I always do this with a patient on the first time to actually get them thinking. I do it for myself because I can't stand dentistry, I'm terrified, and I get myself into a zone where it is my favourite place. My favourite place is California, and I go along Big Sur and I walk up mountains and hills, and I'm visually there. And you can do that. Your body needs to be there for a procedure, but your mind doesn't. And I promise you it works. When I ask somebody, the patient, say, well, where's your favourite place? I had one last week that said Milton Keynes. Now, I did have to think hard as to what nice things are in Milton Keynes apart from concrete cows and loads of traffic circles. But she met her partner in a pub that had a pond. See, water comes in most people's visualisation. But I promise you, try it, and it does work. And when you are worried about something or you are getting nervous about having a procedure, that's the thing. Go somewhere else mentally. You just have to have your body there. Your mind doesn't have to be there. But yes, so what we're trying to try and teach you is a gentle back massage which doesn't do any pressure points. It's all stroking. That's what we use on the wards. That's why every doctor in this place uses our service. And we've been working with NETs a long time. Many years I've been working with these guys. And they totally endorse what we do because we're not an alternative. You don't get us without having procedures done by them. We are endorsed by them because we work safely. But as I say, you can simply act on us. I've given everybody a brochure. If I haven't, please say, and I'll give you a brochure. The switchboard know us very well. I've actually been here 49 years. You're supposed to say I don't look old enough, but you didn't. I started at the Royal Free in Gray's Inn Road before this building was built, and I'm still here. I started when I was 16, so you can all work it out. I'm 66 next month. But I have changed the whole way of thinking of complementary therapy by all the doctors purely because of the safety angle. And that's what we look at every patient in a safe way. For obvious reasons, we're not going to do anything harmful to you. But as I say, stroking and calming down and people's mood, that's why I call it the treat, not the treatment. Because this is a very simple thing that we do that people like. And we all like, you know, especially care of the elderly wards, you can imagine they have somebody there for 20 minutes that they can talk to. How many nurses can waste 20 minutes per patient? If it's called a waste, they're always running around. So we fit in every camp in the sense of being company, having something nice to you. It can be a simple hand massage. It's just as relaxing as having your shoulders. But as you see, I bought 2 pieces of equipment. One, I'm going to do Nadine on a couch, where you're not going to have one of those at home. But there's simple ways of doing it. You can do it on the bed because we're not using pressure. When you're having a full body massage with depth, like a sports massage, bed would be no good because all we're going to do is push the body into the bed. But, you know, for you, it's going to be a gentle procedure. But patient can do non-patient, that's just, and then go in a bit deeper. But it's the whole art of doing stroking, which is rhythmic, which is sort of gives you a soporific tone. It gives you a tone of slowing everything down. So please, number 1, phone us, book us when you come in for an appointment. We don't limit how many you have, and that's the honest truth. I've never limited anybody. So, you know, it's not like I've had 6, will you see me again? We carry on. You know, while you're not feeling 100% or while you're not that well, that's our best time of seeing you. But even when you're well, it can be nice. It's a treat. So I'm going to just get Nadine ready and we'll just do... Yeah, I'm going to put some music on, which once again, if you like relaxing music, don't play music that you know, because you don't switch off. If you love Brahms, you're going to know the next bar of music. And it is quite difficult to actually pick music that you don't know, but that's actually what relaxes you. Because as I say, if you like a piece and you know it, you will know the next bar. So your mind is still ticking over. I'm going to play you some music that was written for us, which has no start and no finish, which is also an art. If I can get this to work, hopefully. So music is a really important thing for relaxation, but don't pick music that you know. Come on, don't let me down. This is a very simple thing. Have we got going? Okay, right, so if you just get your bra on. Yeah, keep it on. Keep the bra on.
Stick it off?
No.
Put it back on.
That's it.
I've opened it, let's close it.
Oh, don't worry. Okay. That's it, go that way. Okay, that's it.
Which way on the bed?
Oh, you can go face down. So as I said, what you mustn't, we don't use pressure points on a healthy body are okay. On a not quite so healthy body, it's not good. Oh, I've got the oil in my pocket. We use an oil to give us a glide, but it's not the oil that makes the massage work. So in other words, you could actually use Nivea or anything. It's not that works. We use a special blend for the hospital because obviously we're dealing with quite ill people at all times and very dry skin. But as you can see, all we do on a clinical massage is slow. It's no good stimulating. The same strokes are used on a sports, but you work faster. So if I was doing Nadine and she was about to go and do an aerobics class, I would work fast. That's the only difference. But, you know, for you, the ideal stroke is this pace. And if you watch this, you will start nodding off, because that's exactly what it does. Have everybody tried a massage? I mean, not everybody likes being touched, I must say. It's not for everyone. But it can be a real thing that you should try. I'm not saying try a local advert, because they possibly won't ever do clinical massage. They might do the other sort of massage and you get a bit of a surprise. But the slowness of the stroke, what makes it work, I promise you. It's because that's how you want somebody just to tick over. You see, like music, it doesn't have a start and it doesn't have a finish. And that just goes with the mood of what you're trying to do. That sort of chair there is the ones you see in the shopping malls, where you can have a massage just fully clothed, having, just walking along the shop and you can sit down and have 20 minutes of that. But we're doing the back, but you could have your feet done. Feet is a great relaxer because that actually radiates right through your body. Hands are just as lovely. Everything feels lighter afterwards.
You could do the feet, I don't mind.
I just said to her, do you want a free massage today? She said, yeah. I didn't tell her where she was coming.
If you have any questions for Keith, you can also...
Yeah, please share. And when we're going on to music, the best, loveliest instrument, but don't use it when you're in a low mood, is the cello. The cello will bring you way, way, way down. It's beautiful, but in the right time. If you're feeling low, it will take you even lower than you can think. So it's just the most beautiful instrument, but played at the right time. Solo piano has a great effect. And I, as I say, for 24 years I've been studying music as well, in the sense of what works with people. And I still like traditional music, but I had one client who used to like Motorhead, heavy rock. And I used to have to do the slowest pace, but of course when you have a fast-going music, you tend to start going with it. But that was the way they liked it. But you can see, you never get bored, and the person will never get bored with these movements, because we're doing circles and just going round all the bits. Shoulder blades always ache. These muscles up here, your trapezius is always one that... And this is called the cat stroke, and all it is one hand following the others.
You said about sports therapists. I go to a chiropractor in Luton.
Yeah.
Now, is it the same sort of thing? I mean, you said about chiropractic.
Yeah, I mean, as long as they're aware of your condition, this is the thing that we must always put on to you, is that some people aren't. Good therapists will say, if you have a condition, will say, I'm not trained to do that. And that's the sensible way. It's not taking something on they don't know. Because honestly, it's like cupping. Have you ever seen the marks on cupping? Really dangerous. That's promoting an enormous bruise on your back. If somebody comes to me with cupping, I won't treat them because I can't treat a bruise. That's in my protocol that, you have to you can't treat a bruise as a massage therapist. So it's really horses for courses. It's just that people that should know of your condition and adapt their stroke in that way. I mean, I'm happy. I get lots of therapists phoning me up and saying, look, I've got Mr. Jones who comes to me regularly. He's just been diagnosed with a cancer. What can I do? And I can go through the things that he can take out of his normal regime and, adapt his massage. Because at the end of the day, it's your body that we have to look after. So I'm not saying a chiropractor would be a bad thing, but he needs to know of conditions. And it's like, if we do an outsider, I mean, everybody is referred to me here, so I can get their medical information easily. But if somebody comes to me privately, I need to know they tell me what they think you know, their body is. And not everybody tells the truth. You know, not everybody wants to let on that they aren't well. And, you know, it's a danger. And then, of course, I'm putting them at risk if I don't know. I mean, here I only work clinically, so I don't work on healthy people unless they've done a marathon or like when George did his exercises for your funds. You know, obviously we can do that because we know he's healthy and he's just exhausted his legs and needs some work usually on the legs. Because when you've done a marathon or any long distance, it's always the backs. You know, you walk down the stairs backwards. I did 4 marathons in my time, but I'm too old for it now.
Yeah, 2 years ago I did a triathlon for the neuroendocrine charity. And 2 weeks before I was exhausted, my muscles were aching, and Keith helped me through just to get up physically in tone for the performance, and it was great.
It's like tuning anything. It's like tuning a car, and you're tuning the muscles when somebody's about to do an event like that. But as I say, when somebody hasn't got the healthiest of bodies, then we're just toning what we can. We're releasing any tension. And by God, you know, you all know that you go through tension when you're getting results, when progression of the disease happens. So these are sort of things that you can still have safely. But we'd love you to come and see us. As I say, it's safe and it's cheap because it's free. Okay, I'm going to turn you around.
So, Keith, I'm not a roll-free patient.
Okay.
And I would absolutely love to have a massage, but I've got really swollen lymph nodes.
Right.
So I don't know where to go.
This is usually the problem. But you're under here at the free.
No, I'm not. I'm under Bart's.
You're under Bart's, yeah, which I don't think they
No.
have any service at all.
No.
The unfortunate thing with our trade is that we're not sponsored by the NHS. I'm the only paid person by the NHS. My 23 therapists, with which only 11 are paid, the others do it voluntarily, I have to raise the funds like these guys have to for NET, which is a sad misgiving because we're the ones that are called right through to the last moments of people's lives, that we take on somebody newly diagnosed and end of life stage. So we go right through the journey, which I'm honoured to be able to do. I love it. As you can see, I'm passionate about what I do. It's been the biggest thing in my life, and yet, even though I've worked at the Free for a long time, I ran a sports centre here for the staff, and that's when I got involved in massage. Never in my wildest dreams thinking I would do a patient. And out of those 30,000, 10,000 are either haematology or oncology patients. So it's a third of our work. And as I say, we're in chemo suites, we're in surgery. I start at 5:30 in the morning, so it's past my bedtime now. I start at 5:30 because I do pre-op. You know, the most nervous time of a patient is just before surgery. And I'm here at 5:30 to be called, and then I jockey with the anaesthetist so that we both see you, but obviously at a convenient time, and just to take the edge off. Obviously, I'm never going to take all the fears, but it can take the edge off, and that's what we do. Well,
Massage therapist.
I'll give you a card, and you can contact me. All right, and then we'll see what we can find for you. Okay. Whereabouts do you live? Area? Hackney. Okay. Leave it with me.
If it helps anybody to make their mind up, you gave my husband a massage before he had surgery. Sorry, before he had surgery, and he said it's the best thing he's ever had.
Well, thank you.
Really, sorry, I can't.
No, don't
He
be.
so enjoyed it, and it made such a huge difference before he went down for major surgery. Go for it, people. Go for it.
It's just, I think, you know, everybody's been confused because they hear such bad things about alternate therapy. And I'd be the first one to tell you that I get a lot of cranks say, I'd love to join your team. We are the most successful team of massage therapists, but I won't take oddballs. I will not, because somebody that does traditional massage might also do crystal therapy or angel therapy. And the thing is, you know, when you send in people under doctor's sort of prescription, it's very dodgy when somebody has lots of alternatives, and I can't risk that. So I turn down more therapists than I actually take on, because I have to trust these guys do how we say we do, with all our patients, you know, your bodies are most important to your doctors. And if I do, I do 30,000 a year, but they'll only remember the one that I did wrong. And you know that. It's the way, that's the fact of life, is they'll only remember the mistake you made. Well, we don't want mistakes. We don't need to do them because we work so gently. But that's why I've got to be so careful on the choice of therapists that I send. And I have the most fantastic team. I mean, I got the MBE, but it's all down to these guys that I got it because of our work. You know, it's a general thing. And I'm hoping that the MBE has made a big difference in fundraising. When I write a letter, it does seem to go a little bit more, which is good. And it's also great for therapy because it is putting us on the map. It'll never put us on the financial map, I know that. Because you know that if we stood at Belsize Tube Station and we said, we've got £100,000 to spend, would you spend it on a massage therapist or more nurses? What would you say? As I would, more nurses. So we do stand down the line. But in saying that, I think we are becoming conscious of our usefulness. And that's really down to the letters that come back to the free about, and ladies like, as just said, that made a difference to somebody. And that's what we're there for. We're to make a difference. And it's a nice thing that can happen. I'm not the one that comes around with the injections and stabs themselves, but, you know, we do the nice bits. But you can only find that out by coming and seeing us. And I do hope you do. Is there any other questions? When you do feet, I will show you. If you put your junk, let's do that. I'll show you how simple the feet are. She has got her own. I think she deserves it, being that I conned her.
Thank you.
Okay. Right. Oh, hold on. You've got me microphone somehow, or I have. That's it. That's it. Okay, I'll do this one so that everybody can see. It's exactly the same as doing a hand, in the sense of, as I say, the oil doesn't matter if you've got, but don't use something like olive oil. Olive oil's for food, not to be put on a body. It does smell. So this is really lovely, our aroma. And all it is round and round the ankles and always towards the heart. You're promoting towards the heart. And if anybody's interested in the music, we do sell the CDs at £7. But that is... Right, it has a jojoba, it is sweet almond. Strangely enough, it's a nut, but never have we had an allergy. It's very minute. But we're only allowed in hospitals to use 1% of essential oils. So there's tangerine, lavender in there. There's a jojoba oil, and it's a very gentle scent because, as you know, if you're lying in a hospital bed, you don't want anything heavy. So it's a very light scent, but it's a nice scent. It's a very gentle one, which, by all means, in a moment, you can always come over and have a smell of the oil. But as I say, it's not the oil that actually makes it work. So you can use a sweet almond oil is really good if you've got dry skin. And most patients do have dry skin with most of the treatments, especially if you're in hospital at any time. The dry skin comes with starching sheets, which they still do, because it's the best way of killing bacteria. But that on skin gives you that ratio of dryness. So, and massage therapists that don't get any care, they get dry skin as well. But you see how simple it is, and all we're doing is just relaxing the foot. And as I say, it's exactly the same with the hands. You do then a squeeze, gentle squeeze of each of the toes, same with each of the fingers.
I'll show them the hand.
Yeah. See, look, now she's pushing a lot. And obviously we're used on a ward for constipation, if that is in reverse of some of your diarrheas, I know. And we have a way of working a set way. And somebody did say to me, if you've got diarrhea, do you work the reverse way? But it doesn't work. I assure you it doesn't. So I don't think we need to So we'll look at abdomen massage. It's just the slowness that you work, and as I say, if you haven't got time on your partner, don't even do it. Because if you're rushing things, they will know you're rushing things, and you'll end up in having a row by saying, you hadn't got time in the first place, why did you start? So if you haven't got time, work slower. That's the most bizarre thing, but it's true. And if I didn't have time to do Nadine's foot, I would work that slow that she would have lost time anyway, mentally. Simple as that. But as I say, it's just the pressure points that people shouldn't do. And when you're doing shoulders... Do you think she's taking liberties with me? You know, it's when you're doing the shoulders, and I will show you by using one of these, because if you are not going to have a couch, but you would have a chair that you could sit forward, put a pillow, and just walk, and you're just forward. And that's enough to get all the shoulders in. So, you know, that sort of thing is easy to adapt. You're not all going to go out and buy a massage couch. And we work even in isolation, so if unfortunately you have MRSA or a bug when you're in, then we would still work on you, but with gloves and apron. You know, so it's just, I do teach clinical massage, and I went to Japan to teach the Japanese. And the one thing I was worried about is I took my case and I was hoping I wouldn't get stopped in Japanese immigration, because I had 50 pairs of embolistic stockings, some with the suspender on the side. I had rubber gloves and masks. And she said to me, and I did get stopped, and she's taking them out, and I'm going, yes, but I'm giving a talk to one of your hospitals. And I got away with it, but I was just terrified. I mean, I wasn't being paid. They paid the charity to send me over there. But you can imagine this woman was going, oh, this very strange man here. Very strange. But yes, so we've got, I'm bringing 30 Japanese over next year, so I'll need loads of patients to work on. So watch this space. It'll be in June, and it'll be a weekend, but I only need one day with real patients. Because they're all qualified therapists, but they're either working in care of the elderly homes or clinical nurses in cancer. Because so many people, so many therapists want to work with cancer, but they don't know how. And in other countries, they just don't get the opportunity. So hence why I went last year, but I can make more money for the charity if I bring them over here. So I'm being... I'd love to go back to Japan, but I have to think of my fund.
So you will let us know when this date is, so we can circulate it?
It's the 5th of June, 2016.
The 5th of June.
Yeah. It's a Sunday morning. And as I say, I know it's a nuisance, but it will be great to have real patients because, you know, obviously I will guide them. They won't be just coming in and doing anything, but I'd have had 2 days with them working on themselves. So, you know, the only way to learn is you do it on yourself first or your colleague and then work on real patients afterwards.
So it's in morning, afternoon?
It's in the morning. It's on a Sunday morning. But what I'll do is I'll give you the date and the times, and then we'll see if anybody would like to volunteer.
I'm sure they will.
I need a mixed bag. I've got, you know, I want neuro patients, care of the elderly, dementia. Well, you could do the dementia one. Yeah. So see how simple it is. There's nothing. We're very, very lucky that we do, and we even put socks back on. We're very lucky that we do something we really love, but it is a simple procedure. We do train for over a year to actually qualify. I think it's still about a year, isn't it? She came, same 24 years. I'm 23 years, so we're old timers at it. But as I say, it's so lovely that we've been able to use our skills in a place like here. And it's just every smile that we get from a patient is just worth its weight in gold. And we always used to say to people, we get paid in smiles. So if you don't smile, we never come back. So it's as simple as that. But if there's any, I'm going to be around over there. So if anybody wants to ask me anything, please do. As I say, if anybody wants to smell the oil, please come and have a sniff. But thank you.
Thank you, Keith.